Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hand. It is Flexon, or the Flick test. So this test came from a paper back in 1984 in which the researcher Dr. Wem Pryse-Phillips noticed something in people who had carpal tunnel syndrome. And he said, after doing all this, that this is a way to differentiate carpal tunnel syndrome from other things like a cervical radiculopathy, cubital tunnel, or even like thoracic outlet syndrome. So let's get in on how to do it. To perform this test, it's pretty simple. All you're going to do is during the evaluation, while you're talking with the patient, you ask them, what do you do to relieve your symptoms? And if the patient does this, it's a positive. They said flicking the wrist like they're shaking out a thermometer. So yes, the old thermometers used to have mercury in them, so they had to shake them down. And this was something that the researchers had just noticed that happened quite a lot, that people that had carpal tunnel syndrome, they would do this maneuver. Now they kind of speculated what goes on. Why does this happen? They said, well, it could be a number of things. They said maybe it increases the proprioception of the thick fibers there, so you're getting a little bit more input. Maybe it increases like a venous pressure in the volume. Maybe it increases the arterial pressure. Maybe it moves the nerve underneath. So they don't really know, but they said this is just something we've noticed that many of these people with carpal tunnel present with. When it comes to the research, there isn't a lot. It is something that's just mentioned if you start looking in research, anytime you get into hands. So an interesting thing with hands, very often in the research, it references a lot of these things. But anyway, so in the original paper, they did find that it did predict some like electrodiagnostic abnormalities in about like 93% of the people there. And that the false positive rate was very, very low, so like under 5%. Now, there was another article that's a little bit more recent in the 2000s, so in 2014, excuse me. And that they looked at this and they said it does have a sensitivity of 47 and a specificity of 62. So there you go. It's just something you see. So it's not like a hardcore test, a big crazy test, but maybe while you're doing it with somebody, just doing an evaluation with somebody, you ask them, hey, what do you do to relieve it? And if they do that, maybe it more likely points over to carpal tunnel. Anyway, with that being said, let us know what you think about it. Are you going to start doing this? Are you going to start throwing that in there? See what you find. Anyway, let us know down in the comments. And as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.